Today we are discussing about development of thyroid gland. So we know that thyroid glands is an endocrine gland which secretes hormones like T3 and T4 and with the thyroxine and triiodothyronine. So today we will see how the thyroid gland develops. Okay, we know that the ventral ends of the first arches, the ventral parts of the first arch, it forms two lingual swelling and forms another swelling called tuberculum impar. It forms two lingual swellings. The ventral part of the first arch, it undergoes swellings. It forms a pair of lingual swelling and one more swelling. That one we call it as tuberculum impar. Tuberculum impar. Okay, so dorsal to the tuberculum impar, we have an elevation. Dorsal to the tuberculum impar, the endodermal cells proliferate to form an elevation. That one we call it as median. Median rudiment. Okay, so dorsal to the tuberculum impar, the endodermal cells proliferate to form an elevation. That one we call it as median rudiment. Then what happens? The endodermal cells, they evaginate downwards and they form a duct. The endodermal cells, they evaginate downwards and form a duct. This duct we call it as thyroglossal duct. This duct we call it as thyroglossal duct. Okay, so this duct goes in front of the hard bone, or sometimes this thyroglossal duct, it descends downwards in front of the hard bone, and sometimes it descends downwards along the backside of the hard bone, and finally it reaches the front of the trachea, where the thyroglossal duct proliferates. The thyroglossal ducts bifurcates. And here what happens is this bilobed mass, they undergo proliferation and it forms the thyroid gland. So what happens here is the endodermal cells dorsal to the tuberculum impar, they undergo proliferation and form a elevation that is called median rudiment. And then what happens here is these endodermal cells, they evaginate downwards and form a duct. That one we call it as thyroglossal duct. This thyroglossal duct, it descends downwards in front of the heart or behind the heart, and finally descends downwards in front of the trachea, and it forms front of the trachea, and it further bifurcates to form a bilobed mass. It further bifurcates and the buds bifurcate, the thyroglossal duct bifurcates, and further they forms the lateral lobes of the thyroid. Here one more thing here is, for the thyroglossal duct, it degenerates, it regresses, but the apical part, the uppermost part of the thyroglossal duct remains as foramen cecum. The upper part of the thyroglossal duct, where the thyroglossal duct descends downwards, that part persists as foramen cecum. Okay, so it forms an elevation. First, the endodermal cells dorsal to the tuberculum impar, they form an elevation. We call it as median rudiment, and the cells evaginate downwards to form a duct. That one we call it as thyroglossal duct. And then what happens? The thyroglossal duct descends downwards in front of the hard bone generally, and it in front of the trachea, where it divides, the thyroglossal duct bifurcates and it forms a bilobed mass that forms the lateral lobes of the thyroid. Usually the thyroglossal duct degenerates or regresses. The uppermost part of the thyroglossal duct, it is seen as foramen cecum. The depression we can call it as foramen cecum. Right. Here what happens here is the thyroglossal duct before regression, the thyroglossal duct regresses. Right. Before regression, what happens here is the thyroglossal duct divides into a bilaminar cords of cells. It divides as a bilaminar cords of cells. Which means the cells are here, they are arranged in two rows, bilaminar cords of cells. The thyroglossal ducts it gives rise to bilaminar cords of cells, and into this bilaminar cords of cells, what happens here is the colloid enters into this bilaminar cords of cells. The colloid enters. That's why we call it as superior thyroid follicles. We call them as superior thyroid follicles are formed. So the thyroglossal duct, before disintegrates, it enters into the substance of the gland. It enters into the substance as bilaminar cords of plates, and into this bilaminar cords of plates the colloid enters. What is colloid? We know that the colloid is nothing but the iodinated thyroglobulin from which the hormones are produced. Colloid is nothing but the iodinated thyroglobulin from which the hormones T3 and T4 are produced by the follicular cells by a process called endocytosis, and they released into the blood. So bilaminar cords of plates, they enter into the substance of the gland. And this bilaminar cords of plates is occupied by colloid. Then we call them as superior thyroid follicles. And this so primary thyroid follicles or superior thyroid follicles, they again undergo budding with each other and form their secondary follicles. Thus the thyroid gland is formed. Thus the entire thyroid gland is formed. Okay, so the upper part of the thyroglossal duct, it persists as foramen cecum. The upper part of the thyroglossal duct, it persists as foramen cecum. And sometimes the lower part of the thyroglossal duct, it remains, and we call it as pyramidal lobe. The lower part of the thyroglossal duct, it remains, and we call it as pyramidal lobe. This pyramidal lobe may arise from the isthmus of the thyroid. We know that the two lateral lobes of thyroid, they are connected by the isthmus. So this is the isthmus, and these are the lateral lobes of the thyroid gland. This is the isthmus of the thyroid gland. So the isthmus of the thyroid gland, here the pyramidal lobe gets attached to the isthmus of the thyroid gland, or sometimes the pyramidal lobe gets attached to the lateral lobes of the thyroid gland also. And what is this pyramidal lobe is? It is nothing but the remnant of the lower part of the thyroglossal duct. It is nothing but the remnant of the lower part of the thyroglossal duct. Lower part of the thyroglossal duct remains as pyramidal lobe. Okay, so with this pyramidal lobe, from the pyramidal lobe, one fibrous band extends. We call it as levator glandulae thyroideae. Levator glandulae thyroideae, which attached to the hyoid bone. Levator glandulae thyroideae, which is attached to the hyoid bone. This is the hyoid bone. Okay, so, and one more thing is, so the thyroglossal duct bifurcates here, and here the thyroglossal duct gives rise to lobes of the thyroid gland as well as the isthmus of the thyroid gland. And sometimes the lateral thyroid rudiments also, these are the lateral thyroid rudiments. We know that this is the lower part of the thyroglossal duct which bifurcates, right? The lateral thyroid rudiments. So what are these lateral thyroid rudiments? We have already learned that in the pharyngeal arches, the fourth pouch along with the fifth pouch, it forms a complex. The endodermal pouch of the fourth one and fifth arches, they form a complex called caudal pharyngeal complex. From the caudal pharyngeal complex, three components are present from the caudal pharyngeal complex. One is thymic rudiment, and next one is lateral thyroid rudiment, and the third one is altimobranchial body. So from the caudal pharyngeal complex, what is caudal pharyngeal complex? It is nothing but the endodermal pouch of the fourth arch and the endodermal pouch of the sixth arch. They together form the complex called caudal pharyngeal complex. Caudal pharyngeal complex. Okay, caudal pharyngeal complex. So from the caudal pharyngeal complex, these derivatives are present. One is thymic rudiment, which helps in the development of thymus, and lateral thyroid rudiment, it also helps in the development of thyroid gland, but it is present as a dispute. We completely don't know whether it helps in the formation of whether it helps in the development of thyroid gland or not. We don't know until researches are going on. So lateral thyroid rudiment may also helps in the development of thyroid gland, which is nothing but a derivative from the caudal pharyngeal complex. And also this lateral thyroid rudiment, what it helps the thyroid gland, it restricts the thyroid gland to go further downwards. It restricts the thyroid gland to go further downwards. That is the function of the lateral thyroid ligament, lateral thyroid rudiment, and also it may also help in the development of lateral lobe of thyroid gland. So that's about the development of thyroid gland. So thyroid gland, it starts as an endodermal proliferation dorsal to the tuberculum impart. We call it as median rudiment. Okay, so from the median rudiment the cells evasinate and they form the thyroglossal duct, and from the thyroglossal, the lower end of the thyroglossal, it bifurcates, further forms the proliferation of the cells, cause the formation of thyroid gland. Here what happens is this thyroglossal duct usually it regresses. The upper part of the duct, it sees as a depression. We call it as foramen cecum. Foramen cecum. And one more thing is the lower part of the thyroglossal duct, it remains as a pyramidal lobe, which may present from the isthmus, and which may arise from the lateral lobe of thyroid glands also. And one more thing is the thyroglossal duct, before undergoes regression, it grows into the substance of the thyroid gland, and it divides into bilaminar cords of plates of cells. So into these cords of plates of cells, what happens here is the colloid enters, and we call them as superior thyroid follicles. From the bilaminar cords of cells, again the budding takes place and secondary follicles are formed. So what is colloid means? It is nothing but the iodinated thyroglobulin from which the hormones produced by endocytosis of follicular cells. Okay, so that's about the thyroid gland development. And coming to the anomalies of the thyroid gland, anomalies of the thyroid gland. Okay, sometimes the isthmus is absent. Sometimes in thyroid gland, the isthmus is absent. Sometimes one half of the lateral lobe is absent, and sometimes only one lobe is present, the other lobe is absent. So these are the different anomalies of the thyroid gland. And one more thing is the thyroid gland may occupy different positions because of the improper descendants of the thyroglossal duct. The thyroid gland may occupy different positions. For example, the thyroid gland doesn't descend downwards and situated at the tongue only. We call it as lingual thyroid. Sometimes the thyroid gland descends a little bit lower to the tongue. We call it as intralingual thyroid. Sometimes the thyroid gland may present at superior to the hard bone. We call it as suprahyoid thyroid. And sometimes the thyroid gland present just below the hard bone. We call it as infrahyoid thyroid. Usually the thyroid gland, it occupies in front of the trachea. Generally it descends downwards in the mid-ventral line and it occupies the front of the trachea. This is the normal position of the thyroid gland. So that's about the development of thyroid gland. And sometimes what happens is this thyroglossal duct remains and it forms a cyst called thyroglossal cyst. If the cyst opens outside into the skin, then we call it as thyroglossal fistula. So thyroglossal cyst and thyroglossal fistula are because if the thyroglossal duct doesn't undergo regression, then it gives rise to thyroglossal cyst and thyroglossal fistula. Thyroglossal cyst and fistula because the thyroglossal duct doesn't undergo regression properly. If the thyroglossal duct present, then it gives rise to thyroglossal cyst and thyroglossal fistula. So that's about the thyroid gland. So we have seen that how the thyroid gland develops, and the upper part of the thyroglossal duct we call it as foramen cecum. And here we have seen that this is the pyramidal lobe, which is nothing but the lower remnant of the thyroglossal duct. And the lateral thyroid rudiments they also help in the development of thyroid gland. They prevent the gland from descending further downwards. Okay, so that's about the development of thyroid gland. So And now we are discussing about development of pituitary gland. So pituitary gland, it arises. We know that the pituitary gland consists of anterior lobe and posterior lobe. Both have different origins. The anterior lobe is different, it has different origin, and the posterior lobe has different origins. Okay, so coming to the anterior lobe. So the anterior lobe develops as a endodermal diverticulum from the roof of the stomatodium. We know the stomatodium is nothing but the primitive mouth. So the stomatodium, from the roof of the stomatodium, and ectodermal diverticulum arises just in front of the notochord, cranial to the notochord, and just above the buccopharyngeal membrane. We know that this is the buccopharyngeal membrane. Is the stomatodium, primitive mouth is present here. So then ectodermal diverticulum, it arises upwards, it goes upwards from the roof of the stomatodium, just in front of the buccopharyngeal membrane and cranial to the notochord. So this pouch, this diverticulum, with this ectodermal diverticulum, we can call it as Rathi's pouch. This ectodermal diverticulum which grows upwards, we call it as Rathi's pouch. Then what happens here is, due to the overgrown of the mesoderm, this is the overgrown of the mesoderm, this Rathi's pouch cut off from the floor of the stomatodium. This Rathi's pouch get cut off here. So see here, this Rathi's pouch gets cut off here from the floor of the stomatodium, from the roof of the stomatodium. The Rathi's pouch get cut off, and here what happens is the Rathi's pouch cells, the cells of the ectoderm, they proliferate and they give rise to pars anterior cells. So this diverticulum, it remains as a cleft. This diverticulum, it remains as a cleft, that is called intraglandular cleft. We know that in the pituitary gland we have intraglandular cleft is present here. So in the pituitary gland we will be able to see an intraglandular cleft is present in the pituitary gland, anterior pituitary, and this is the posterior pituitary, right? An intraglandular cleft is present here, and this intraglandular cleft, the part which is present behind the intraglandular cleft, we call it as pars anterior. So the part which is present in front of the intraglandular cleft, we call it as pars anterior, and the part which is present just behind the intraglandular cleft, we call it as pars intermedia. And the part which extends above through the infundibulum or stalk of the pituitary, we call it as pars tuberalis. So what happens here is, so the Rathi's pouch, it extends upwards and to the forebrain vesicle, and here in just in front of the buccopharyngeal membrane. Then what happens is, it gets cut off due to the overgrown of the mesenchyme. It gets cut off to the surrounding overgrown of the mesenchyme, and it remains as the intraglandular cleft, and the part which is in front of the intraglandular cell, the cells proliferate rapidly. So that part we call it as pars anterior. And the part behind the intraglandular cleft, here the cells, they doesn't proliferate rapidly, it remains as pars intermedia. And the part which extends into the stalk, into the infundibulum, we call it as pars tuberalis. So that is the development of the anterior pituitary. So the anterior pituitary is developed from Rathi's pouch, which is nothing but an endodermal diverticulum from the roof of the stomatodium, just in front of the buccopharyngeal membrane, cranial to the, just in front of the buccopharyngeal, cranial to the notochord. Then what happens is, this Rathi's pouch, due to the overgrown mesenchyme, of the mesenchyme, it gets cut off here. So see here, and here what happens is, the intraglandular cleft remains. The cells in front of the intraglandular cleft, they proliferate rapidly and gives rise to pars anterior, and the cells which present behind the intraglandular cleft, they doesn't proliferate rapidly. It gives rise to pars intermedia, and the pars cells which extends upwards into the stalk, we call it as that stalk, we call it as infundibulum. These cells we call this part gives rise to pars tuberalis. So that is the development of anterior pituitary. And coming to the posterior pituitary, so from the posterior pituitary, it is developed from the diverticulum. It is developed from a diverticulum from the diencephalon, from the floor of the fourth ventricle. A diverticulum descends downwards from the diencephalon. This diverticulum gives rise to posterior pituitary. Then what happens here is this diverticulum, it is just beside the anterior pituitary, and it fuses with the anterior pituitary. So this is the blue one. I have remarked this one, blue one is the posterior pituitary. So the posterior pituitary arises from the diverticulum from the diencephalon, nothing but from the floor of the third ventricle. From the floor of the third ventricle, a diverticulum descends downwards which fuses with the anterior pituitary. That is called posterior pituitary, otherwise called as neurohypophysis. Anterior pituitary, otherwise called as adenohypophysis. So the posterior lobe develops from the diverticulum from the diencephalon. Okay, then so we can see the differentiation present between the anterior lobe and posterior lobe. In the anterior lobe, we can see the chromophil cells and chromophobe cells are present, which further divides into estrophils and basophils. The chromophil cells again divides into estrophils and basophils, and these estrophils again gives rise to mammotrophs and lactotrophs. They gives rise to growth hormone, and they produce these estrophils. They regulate the growth hormones and also prolactin, and also they release adrenocorticotropic. They produce adrenocorticotropic hormones. All these hormones are produced by the anterior pituitary, and also melanocyte stimulating hormone is also produced by the anterior pituitary. So all these hormones are produced by the anterior pituitary. But in case of posterior pituitary, because of differential development in posterior pituitary, we can see only, of course it is developed from neuroclustal origin, of course it is developed from the brain, but it doesn't contain any neurons. Only unmyelinated nerve fibers are seen in the posterior lobe, along with some neuroglial cells called supporting cells called pituocytes. So in the posterior lobe, we can see only unmyelinated nerve fibers are seen, along with supporting cells called pituocytes. And here it consists of fibers from the hypothalamus. We know that two hormones produced from the hypothalamus, from the supraoptic and paraventricular nuclei. One is oxytocin and one is vasopressin. So vasopressin and oxytocin, they are developed from the hypothalamus, and through these unmyelinated nerve fibers they reach here, and they posterior lobe, it is nothing but it stores the vasopressin, nothing but the antidiuretic hormone, and oxytocin. It doesn't synthesize any hormones. It acts as a storage place for the oxytocin as well as the ADH hormones, which are developed from the hypothalamus, from the supraoptic as well as the paraventricular nuclei. So that is the development of the pituitary gland. So the anterior lobe of the pituitary develops from the rectus pouch, which is nothing but the ectodermal diverticulum, which grows upwards from the roof of the stomatorium, just in front of the bronchopharyngeal membrane, cranial to the notochord. And here the intraglandular cleft, the cells in front of the intraglandular cleft, they proliferate rapidly. And they forms the pars anterior. The cells behind the intraglandular cleft, they doesn't proliferate rapidly, and they remains as pars intermedia. Some cells they go up to the stalk, we call it as pars intermedia. And coming to the posterior pituitary, it extends as a diverticulum from the diencephalon, nothing but the floor of the third ventricle, and here it passes just beside the anterior pituitary and fuses with it. It doesn't consist of course it is of neural crystal origin. It doesn't consist of any neurons, anything. It consists of unmyelinated nerve fibers and some neuroglial cells called pituocytes. So that's about the development of pituitary gland. So today we are discussing about development of salivary glands. We know that we have 3 salivary glands are present. The largest salivary gland is the parotid gland. And the second one is the submandibular gland, which is situated in the submandibular region. And the third one is the sublingual gland, which is present nearer to the submandibular gland, sublingual gland. Submandibular gland and sublingual gland. These are the three salivary glands. These are the three main salivary glands present. And coming to the parotid gland. Parotid gland, it develops as an ectodermal furrow from the angle of the primitive mouth. We know that the angle of the primitive mouth situated nearer to the auricle. We know that at the primitive stage, before the formation of face, the angle of the primitive mouth which is situated, that means these are the angles, right, which is situated anterior to the auricles here. And here, now what happens here is, the parotid gland, it develops as an ectodermal furrow. It develops as an ectodermal furrow during the 5th week of development, 5th week of intrauterine life, during the 5th week of intrauterine life. Then what happens here is, the cells in the furrow forms a cube-like structure. The cells further grows forwards and medially and form a tube-like structure. These ectodermal cells, they proliferate and form a tube-like structure. We then called it as parotid duct. Parotid duct. So, first the opening of the parotid duct is present near to the auricles, and what happens is, because during the formation of face, the maxillary processes and mandibular arches, they get attached with each other, so that the angle of the mouth from here to, it comes to here to the normal position. So the parotid duct also moves along with the angle of the mouth, right? And coming to the, from the lateral end of the, this is the medial end and this is the lateral end of the parotid duct. So from the lateral end of the parotid duct, the ectodermal cells proliferate into the surrounding mesenchyme. Into the surrounding mesenchyme, the ectodermal cells proliferate. They form ductules as well as acini of the gland. We know that parotid gland consists of serous acini, right? So the ectodermal cells, they proliferate and they grow into the underlying they grow into the mesenchyme, and they forms the canaliculi and acini. They form the ductules and as well as the acini of the gland. So that is the formation, that is the development of parotid gland. And here one more thing is, the parotid duct moves along with the angle of the mouth and it opens into the vestibule of the mouth opposite the crown of the upper second molar tooth. So the parotid duct opens into the opposite the crown of the upper second molar tooth. Okay, so the parotid gland, how it develops means, the parotid gland, it develops as an ectodermal furrow. So the gland is ectodermal in origin. That is the most important point. So the gland is ectodermal origin. So the parotid gland, it develops as an ectodermal furrow, and further what happens is, this ectodermal furrow, it grows forwards and medially, and further it becomes narrower and it forms the parotid duct. From the later, it is called tube-like structure, it further forms the parotid duct. From the lateral end of the tube, the ectodermal cells proliferate into the underlying overgrown mesoderm, and they proliferate into the deep to the mesenchyme, and they form the ductules as well as the acini of the gland. And further, because of the fusion of the maxillary process and mandibular arches, the angle of the mouth from here to, it comes to the normal position, and here the parotid also comes along with the angle of the mouth, and it opens into the vestibule of the mouth opposite the crown of the upper second molar tooth. How the acini and ductules are formed? The acini and ductules are formed by the proliferation of ectoderm into the mesenchyme, which gives, and further they canalize it to form acini as well as ductules of the gland. Okay, and one more thing is, the parotid gland is ectodermal in origin, which further supports by the myoepithelial cells. The parotid gland is ectodermal in origin, we know that, which is further supported by the myoepithelial cells. Myoepithelial cells also present in the acini. They are present between the acinal cells. For example, if you take the serous acini, so serous acini, we know that it is having some pyramidal shaped cells are present. Nucleus is situated rounded and situated at the base, and between the basement membrane and the pyramidal shaped cells, the myoepithelial cells are present here. These myoepithelial cells are also ectodermal in origin. That's why the parotid gland is also ectodermal in origin. Okay, so that's about the parotid gland, which develops during the 5th week of intrauterine life. And coming to the submandibular gland is developed during the 6th week of intrauterine life. 6th week of intrauterine life. Okay, so how the submandibular gland develops? So submandibular gland develops as an endodermal outgrowth. The gland develops as an endodermal outgrowth from the linguolabial groove. From the lingual gland and labium, we have a groove that's called linguolabial groove. So submandibular gland develops an endodermal outgrowth. It develops as an endodermal outgrowth. Endodermal outgrowth from the linguolabial groove. Okay, so this from the linguolabial grooves, these forms, they further grow and grow by forming the acini and as well as the ductules of the gland. They form the acini and the ductules of the gland, and the floor of the edge of the endodermal outgrowths. From the floor of the edge of the endodermal outgrowths, they unite, they form the submandibular duct. So the submandibular gland develops as an endodermal outgrowth from the linguolabial grooves. Further they grow, they proliferate, and they form the acini as well as the ductules of the gland, and the floor of the edge of the endodermal outgrowths, they form small ductules, and these small ductules they unite to form a large duct that is called submandibular duct, which opens into the sublingual papillae on either side of the frenulum ligvae. We know that frenulum ligvae is nothing but a mucous fold which attaches the tongue to the floor of the mouth. We can see by raising the tongue upwards, we can see the mucous fold which attaches the lower surface of the tongue to the floor of the mouth. Okay, so that's about the submandibular gland development. And coming to the sublingual gland is developed during the 7th week of intrauterine life. 7th week of intrauterine life. And how the sublingual, they are nothing but the lateral outgrowth. lateral endodermal outgrowths from the submandibular gland. So from the submandibular duct, the sublingual glands arise. Okay, so that's about the sublingual glands. So parotid gland, submandibular and sublingual. Out of this, parotid gland is ectodermal in origin, which develops during the 5th week of intrauterine life. And submandibular ducts and submandibular gland and sublingual glands, they are endodermal in origin. They arise as endodermal outgrowths from the linguolabial grooves. From the linguolabial groove, they are arise as the endodermal outgrowths. So the sublingual gland, they arise from the lateral outgrowths from the submandibular duct. Submandibular duct, it gives rise to lateral outgrowths, which further gives rise to sublingual glands. So that's the development of salivary glands.